What's up everyone, this is Wasim and today I wanted to talk about pharmacy school, especially everything around studying for pharmacy, what it involves, the type of classes and courses that you have, the length of the program, and so on. I really wanted to give this information to clarify what it looks like to be a Pharm.D, to actually study for the Pharm.D and earn the Doctor of Pharmacy title. So let's go. So first of all, let's clarify the title that you will have after you graduate from pharmacy school. There are actually 2 degrees that you can get that are related to pharmacy. Either a Bachelor of Pharmacy or a Doctor of Pharmacy. Today I will be talking about the Doctor of Pharmacy title simply because it's the degree that I'm pursuing right now, and it's also the degree that most schools are turning to in the United States and Canada where I live. The Bachelor of Pharmacy allows you to practice pharmacy, but in general is less clinical than the Doctor of Pharmacy degree, which has a lot of clinical classes and is much more oriented to pharmacotherapy, which means the management of disease through medication in different types of patients. Typical pharmacy school lasts from 4 to 5 years. In that length of time, you will have various clinical classes, such as cardiology, infectious diseases, endocrinology, etc. So you will have classes that teach you how to manage disease with medication for your patients. You will also have clinical laboratories where you will actually be able to simulate and practice with fake patients, your interactions, so you can become a healthcare professional and you can, improve your communication skills with patients. Also, you will have other classes that will teach you the scientific method, the way of doing research, the way of evaluating different clinical papers, and to evaluate, the scientific literature. After all those 4 to 5 years, you will actually become a healthcare professional and an expert about the use of drugs in the management of disease. You will also become qualified to interpret scientific data, clinical scientific data, in order to have a clinical judgment on a disease and how to use medication to manage this disease. So it's 4 to 5 years of really hard work. There are a lot of classes. Pharmacy school is no joke. It's really, it's a lot of work, but at the end, I think it's really rewarding. So here is an outline of the different classes that you will have throughout your Pharm.D degree and which will allow you to graduate. First of all, you will be completing basic and pharmacological sciences, such as, for example, general physiology classes. In these classes, you will go through the general principles of the human body, its physiology, its anatomy, etc. For example, you will be studying the nervous system, the musculoskeletal system, the renal system, the pulmonary system, etc. This is really important because it will give you the foundations on which you will build your clinical skills. Also, since our expertise is on medication, you will also have pharmacology classes which are extremely important. You will learn about the basics of pharmacokinetics, pharmacodynamics, and galenics, which are different types of sciences related to pharmacology, which are very important for our pharmacists to understand in order to practice. Of course, since our profession is related to healthcare and we are healthcare professionals, we will also receive clinical courses in order to complete the Doctor of Pharmacy degree. You will have different clinical courses on the management of disease, for example, in psychiatry, in obstetrics and gynecology, in neurology, cardiology, etc. So by the end of your program, you will have went through pretty much every single system, every single body system of the human body, and you will have studied the great, most important, most common diseases related to this system. You will also have various other courses that are also extremely important for the practice of pharmacy. For example, laws regarding pharmacy practice, communication, ethics and bioethics, the sociology of health, the analysis of scientific literature, notes and classes about epidemiology and clinical statistics, so you can interpret scientific data, and so on. There is also a portion of the program which is devoted to teaching the history of pharmacy, from apothecaries to clinical pharmacists that we have nowadays. Also, in order to complete your Doctor of Pharmacy degree, you will have to complete various clinical rotations and internships in different clinical hospitals or community pharmacies. Such internships can include internal medicine, cardiology, organ transplant, emergency department, geriatrics, and so on. You will also be in contact and practicing general primary care pharmacy in communities pharmacies, which will be the scope of practice that is most common for pharmacists. And if you think that after all those hard years of work, you're done and you don't have to study anymore, well, you're wrong. When you choose the pharmacy profession, you pretty much become a student for life. The reason for that is that all, medications and all clinical condition and diseases evolves, and the research and discoveries keeps adding up. So how we practice pharmacy today will be very different from how we practice pharmacy in 10 years from now, simply because there will be probably more drugs, more therapies, and we will probably manage diseases very differently in 10 years from now. So you're in, to a lot of studying even after you've graduated from pharmacy school. But I think it's really worthwhile, because when you really help a patient and you help him manage his disease, it really makes all the difference in the world, and I think it's extremely rewarding. I would say that pharmacy is really oriented to somebody who really likes to work with people, who is really curious, and who really likes, to keep learning, is very curious, and really wants to make a difference in the healthcare management of people. So if you're one of these persons, well, then you might consider, applying for pharmacy. Good luck.